Good afternoon. Happy New Year, everyone. We're so happy that you could join us today. My name is Tamara Bingham. I'm the Director of Business Development here at Center for Change. I'm here with Ali Willits, who I'll introduce in just a few minutes. We're so happy you could join us today and hope that you and yours are well wherever you are. Couple of things before we get started. We have some housekeeping items you'll see up on your screen. A copy of the PowerPoint is in the handout section of the toolbar. It's also on our website, so if you aren't able to download it for some reason out of the toolbar, you can go to centerforchange.com, go to the professionals tab. You'll see webinars there, and then all of the handouts for today's webinar are listed there as well. A copy of the post test is in the handout section of the toolbar, along with a couple of other handouts that Ali has provided today. So keep in mind, however, that the post test is for reference only. You're welcome to pull it up and look at it or print it out while Ali's presenting, but in order to obtain CE credit, you must take the post test online, and I'll talk more about that in just a minute. You're welcome to submit questions in the questions section of the toolbar. We'll try to get to a few at the end of the webinar. There are a significant number of you online today, and we're thrilled to have you with us, but it also means that taking questions in the moment is just really challenging. So if you'll write those in the question section of the toolbar, I'll keep an eye on them throughout Ali's presentation, and then at the end, I'll try to get to some of the questions. Ali also has her contact information on one of the slides, I think the last one. So if we don't get to your question, you're more than welcome to reach out to Ali directly. When the webinar ends, an evaluation will pop up on your screen. If you take about 30 seconds to complete that evaluation, we would really appreciate it. That's a continuing education requirement for us. That's completely anonymous, so please feel free to be candid in your feedback. We then tally that information and send it to the CE entities as a follow-up to our requirements. And then about an hour after the webinar ends, you'll receive a separate email with the link to take the online test. As I said, you must take the test online in order to receive continuing education credit. Don't panic if you don't see it right after the webinar. It takes about an hour for GoToWebinar to send those emails out. There'll be a link there then to take the test. Okay, I think that's all of our housekeeping items. We're so happy to have Ali Willits with us today. Ali is a primary therapist at Center for Change Boise. She's a phenomenal therapist and really skilled and knowledgeable, and is really an expert in ACT. And I'm excited that you get to hear from her today. Just a little note as well that she's also a really beautiful artist and oftentimes incorporates art into her therapy sessions, and we get to benefit or reap the benefits of having Ali's art from time to time on our Service Excellence Committee. So we're thrilled to have Ali with us, and so I'm going to turn it over to Ali. Ali, give me just a second to share my screen, or change screens actually, and send it to you. Here it comes.
Okay. And let me pull up my webinar.
Perfect, I see it great. So I'm going to go ahead and turn off my camera and my mic, but I'm here. If you need me, Ali, if something goes wonky, let me know. Otherwise, I'll keep an eye on questions, and then we'll see you at the end.
Sounds good. Okay, let me just, all right. Well, I may actually need you for a second. Oh, there we go. Okay, I found it.
Okay.
We're good.
All right,
yes,
sounds good.
Sorry. I had it so I could only see myself for a minute. That was a little weird. All right, so thank you so much for that excellent introduction. I am very excited to be here today and to share a little bit more about acceptance and commitment therapy. I shared last year for Center for Change, and I've learned a lot in the past year, so I'm excited to kind of continue to grow in my knowledge and also be able to share it with you. These are my objectives of my presentation today. I'm hoping that you'll be able to recognize the connection between the 6 core processes and the 6 core yearnings in ACT. We'll also be talking about the dark side of feel-goodism and kind of what that means in context. Then we will also be learning different various ACT skills to help clients in creating a valued life that's focused on direction rather than destination. Let me just move this control panel out of the way. Oh, there we go. So as Tamara said, I'm a primary therapist here at Center for Change in Boise. The clients that I mostly work with struggle with eating disorders, and I love to work with adolescents. So that's the population that I really focus on. As Tamara mentioned, my background is in both art and psychology, and then in graduate school, I focused on different types of addictions. I started learning about ACT really in 2019 after coming from an Adlerian approach and sort of trying to find my footing in the world and figure out what theory I wanted to make my base. What I really like about ACT is it's incredibly approachable, it's very authentic, and to me it's been very life-changing. And I've seen huge changes not only in myself as I've put different ACT tenets into my own practice and my own journey, but also with my clients. So it's been really, really cool to see, and I'm excited to share more about it with you guys today. ACT is wonderful because it is evidence-based not only for clients, but also for clinicians. So I want to give you some quick stats or quick studies to sort of start us off. So clients that attended ACT groups for residential treatment showed lower rates of rehospitalization after 6 months compared to those who did not attend ACT groups. For adolescents, which again is the population that I really love to work with an anorexia nervosa or subthreshold anorexia nervosa, a family-based approach based on ACT has been shown to reduce eating disorder pathology. Then finally, in an eating disorder sample, an ACT group intervention that focused on body image was effective at reducing residual eating disorder symptoms and body image problems. As I said, ACT is also helpful for clinicians, and there's that big word, burnout. And this is a word that's been thrown around a lot the past couple of years. I know it's something that I've experienced as a clinician in the time of COVID that seems to never end. And ACT has been really, really great in helping myself deal with COVID, or not with COVID, with burnout, but also with my fellow colleagues. So acceptance-based treatment may be beneficial for patients with more severe eating disorder pathology. And this is really, really helpful coming from a clinician standpoint because these are the clients that you are more likely to feel maybe somewhat discouraged or a little bit stuck working with. Psychological flexibility, which is a huge part of ACT, is associated with lower compassion fatigue and greater compassion satisfaction, probably something we could all benefit from right now. ACT has also been helpful as an intervention for sexual minority employees struggling with work stress and burnout. So again, helpful for clients, but also really, really helpful for clinicians. So where did ACT come from? ACT is considered a third wave of CBT or cognitive behavioral therapy, with the first wave focusing on conditioning or behaviorism, the second wave focusing on thoughts and beliefs and understanding and changing emotions, otherwise known as cognitive behavioral therapy, as most of us know it. And that's really also focused on the work of Ellis and Beck. The third wave is the wave where ACT falls under, and it's kind of family members with DBT, mindfulness, deeper theories that go a little bit deeper underneath those thoughts, feelings, and emotions. The third wave of CBT really prioritizes the holistic promotion of psychological and behavioral processes rather than trying to eliminate or reduce different symptoms, psychological or emotional. So what this means is that ACT is a little bit different than some other theories because we don't try to get rid of those challenging maybe thoughts, feelings, beliefs, body sensations, or behaviors, but instead we learn how to cope with them in ways that are more aligned with what you value. ACT is actually a pretty new theory founded by Stephen Hayes in 1982, and it falls under the relational frame theory umbrella. The original name of ACT was actually comprehensive distancing, and this name was given due to the deliteralization and diffusion of different vocabulary words and different meanings. So according to Stephen Hayes, the primary source of human unhappiness is the way language and cognition interact with the circumstances of our lives to produce an inability to persist or make changes that are in the service of long-term valued ends. In ACT, again, we really focus on psychological flexibility. So inflexibility is what happens when we use language and tools in ways that are ineffective or problematic. Even if they might be things that we are used to using, they may not be the most effective tool that we can use in order to continue to grow. The point of ACT isn't necessarily to feel better or get rid of all those challenging feelings, but to better feel. So what that means, again, is finding out a way where you can coexist with challenging thoughts, emotions, body sensations, and different feelings rather than trying to completely eliminate them. Stephen Hayes said the best way to fail is to be stubborn. I love that quote. And we see stubbornness or stuckness in psychological inflexibility. So in looking at this hexaflex, you may recognize yourself or your clients here, and that's okay. A lot of times we look for the wrong solution for the right reasons, and that results in choosing inflexible processes. So it's important that we know what yearning that we are trying to meet, because these different yearnings are each connected with different processes. And we're going to be talking about this more in depth as we go on. The first process I want to go over is the absence. Oh, go ahead.
Hang on. It sounds like somebody has unmuted themselves. Folks, be sure to stay muted, please. It's going to take me a second to unmute or to mute everybody again, and that means it will mute you as well, Allie. So hang tight for a second while I do that. Everybody hold on, please. Okay, Allie, you should be unmuted. Will you try for me?
Yes. Can you hear me?
Okay, yep, I can hear you. You're good to go. All right, folks, just remember, please don't touch your mute buttons. Let's stay muted, and then we'll let Allie keep going.
Perfect. Thank you, Tamara. And what a great example of the importance of being flexible. So thank you for that segue. So as I was saying, we can recognize ourselves and probably our clients or vice versa in this model of psychological inflexibility. Again, we are trying to look for the wrong solution for the right reasons. So we have different yearnings that we are trying to treat with different inflexible processes that are not as effective as they could be if they were flexible. So we're going to go over each of them just quickly here and then more in depth throughout this presentation. The first is absence of awareness, living without mindfulness. The second, we have fear, allowing fear to dictate our direction. We have stagnation or not taking action due to fear driving the bus. A conceptualized self, which is seeing ourselves in a very specific way that doesn't allow for change or growth. Avoidance, of course, is suppressing or denying emotions because they're not considered acceptable. And then a fusion is allowing thoughts, feelings, emotions, and body sensations to run our lives. So if we can recognize what the yearning is that we are treating with an inflexible process, we can help our clients and ourselves pivot to a more flexible process. And it's important to remember that each of these processes does have a place and they can be considered helpful at times, definitely. But when they dominate our lives, that's when it becomes harmful. So in response, let's look at the ACT hexaflex for psychological flexibility. And this invites a flexible response to our core yearnings. So we have being present, which is increasing our mindful awareness. We have values, identifying what's important to you. Committed action is taking action based on what you value rather than avoiding what you fear. Self as context is the you that has always been present. Acceptance is accepting rather than avoiding or suppressing emotions. And then finally, diffusion is getting distance from or the literal unhooking from thoughts, feelings, emotions, and body sensations. And if this appears a little bit overwhelming for you, don't fret. We'll be going over each of these in more depth on individual slides. This is a general overview of what Stephen Hayes believes leads to the best and most effective psychological health. So these core yearnings that I mentioned are motivators that can drive us towards either flexible or inflexible responses. We have a yearning to belong and connect. We have the yearning of coherence and understanding, orientation, feeling, self-directed meaning, and competence. And you can see in the blue, these are our inflexible responses to these core yearnings. We all do it, it happens. But we can also pivot ourselves and our clients towards these core processes that are flexible and more likely to lead to growth and deeper meaning and deeper connection. Stephen Hayes said it's normal to have a story about your life, but it's harmful to your connection with others when you become fused with that story. And we see this in our first core yearning that we will be looking over, which is the yearning to belong and connect. We all long to belong, and we often feel like we cannot belong unless we are seen as special or different. So an inflexible response to this core yearning may be a client who views their diagnosis as a prize, or maybe a client who only sees themselves as somebody who struggles with an eating disorder and not separate from that. I've also seen this inflexible response in individuals who have had one very specific role in their life, and when they're no longer active in that role, it's difficult to see who they are outside of it. So for example, I've had students who have gone through college and graduated, and now they no longer feel that they can call themselves a student, so they wonder who they are and what role they now have. If an identity becomes all-consuming and inflexible, there's not a lot of room for growth or change, and this can often lead to suffering. So we can help our clients pivot from that conceptualized self that is so focused on different roles and evaluations into a flexible response, which is the self as context. The self as context, I'll admit, is a little bit challenging to explain over a PowerPoint. It's best experienced through an activity like mindfulness or meditation, because this is the you that observes that you're observing. This is the identity that has always been present, and it's a powerful resource within you that many people don't know about. This resource is really great because it helps you get away from all those labels or judgments that you've given yourself or that others have given you. It helps you experience a more powerful, deeper connected sense of self that has always been present. So one way to help your clients to see if they're more identifying with the conceptualized self versus self as concept is simply showing them this screen, asking them if they recognize that they're having a more inflexible response or a flexible response. And I've done this with my clients before, and it's actually been really helpful for them to see that they've been stuck in believing they can only have a certain role or be a certain thing, and they're unable to grow and pivot towards that self as context. Hopefully you all understand this meme, Uncle Rico from Napoleon Dynamite. I think he's a great example of the conceptualized self, because for him, who he is often attributed to what he does or does not do. So if you're familiar with Napoleon Dynamite, Uncle Rico often believed that if he had just been given more time or more opportunities, he could have made it really, really far in football, and he's really stuck there instead of acting the age that he is. So you can tell that he's really stuck on that conceptualized self that is stuck in a role. You've seen that body image and self-esteem often declines later in life, and sometimes this can be linked to feeling as though you don't have a purpose. So if you were to look at a graph of self-esteem throughout the lifespan, it goes up, 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 some downs, and then about the time you retire, it's almost at its peak, and then we see a sharp decline. And part of this decline has been linked to no longer feeling like you have a role or that you are good at a role instead. So if we hold tightly to things that are bound to change, we are bound to suffer because we are just stuck there and we're unable to grow. So one question that I like to ask my clients is have them think about what they need to hold loosely. And if you think about this question a little bit deeper, there's plenty of things that we need to hold loosely in our lives. So the biggest example that comes up when I lead my ACT group is actually COVID. We cannot predict what's going to happen, and we can do what we can to take care of ourselves and do what aligns with our own values, but we can't predict what's going to happen. And so that's an example of something that we need to hold a little bit loosely. The next core yearning, our second one that we will be looking over, is the need for the yearning for coherence and understanding. We want to make sense of what we're experiencing. All of us want to understand what is going on. I think feeling confused and feeling lost is probably one of the worst feelings for any individual. An inflexible response is only one way of thinking, and your way of thinking must be true. So these are individuals who may have blinders on their eyes. This is it. There's nothing wrong or nothing that I'm going to challenge about what I'm experiencing. So they may have the thought, I am not enough, and just stop. End of discussion. That's it. Completely stop. If we can help our clients pivot from fusion, which is that inflexible response where there's no distance between what you feel and who you are as an individual, into diffusion, we can help them actually separate themselves or get some distance from those thoughts, feelings, emotions, and body sensations. So instead of saying, I notice, or instead of saying I'm not enough, you might have them say, I notice I have the thought that I'm not enough. So even adding just a couple more words can help them get that flexible response and a little bit more distance from what they're experiencing. And if you want to take it a step further and add in a few other core yearnings and different processes, you can also have them say something like, and I'm willing to do blank because it aligns with my values. So for example, I notice I'm having the thought that I am not enough, and I'm willing to eat this meal anyway because it aligns with my value of recovery and getting out of here so I can spend more time with my friends. I have this really great illustration that talks about the difference between fusion and diffusion. So if you came to my webinar last year, you may recognize that these images do have names that my clients named them, so I'm going to share them with you. On the left, we have fusion, which has been named Cornelius, and diffusion, which has been named Sulenrock. So you can take that information with you as you wish. Fusion on the left is like wearing a bubble on your head. So you may have the thought that you are not enough. All you see is that thought you are not enough, and that colors your entire world, your entire vision. Everything that you see reiterates that thought back to you that it must be true, and there's, again, no separation between what you experience and who you are as an individual. So this can be very, very paralyzing. On the right, you see Sulenrock, again, Cornelius backwards, who is practicing diffusion. So he may have the exact same thought as our fellow on the left, but instead of it coloring his entire world, he's able to say like, I notice I'm having this thought and I'm willing to blank because it aligns with my values of blank, blank, blank. The difference between these two is not the absence of a challenging thought, feeling, emotion, or body sensation, but there is a big difference about the way that these two individuals see the world and the way that they're able to interact with their surroundings. So if you are looking for an easy way to teach a client about fusion versus diffusion, I highly recommend using an illustration like this because it's something that's very easy to understand and also really easy to address later in sessions and say, oh, are you feeling like you're fused or feeling like you're kind of using a little bit more diffusion today? The next core yearning that we are going to be going over is orientation. Orientation is the yearning to know the space that we're in, both physically and spiritually in the past, present, and future. I come across a lot of clients who say, I have no idea what I'm doing. I have no roadmap. What is even happening? I'm so lost. I don't have any direction. Life just happens to me and I have no control. Okay, that's a lot. I can understand why you're feeling very stuck. And at the same time, that inflexible response is demonstrating a lack of awareness. Because if we're to dig a little bit deeper and help our clients be present, you can help them ask questions like, who and what is important to you? How can we increase your sense of mindfulness in the moment and mindfulness in where you're going? One phrase I like to use is to be where your feet are, and just have my clients plant their feet on the ground and take a moment, sometimes take their shoes off, take a moment to just really feel the ground and recognize where they are, because often they'll feel that they're stuck in a different time period rather than the present. Another quick phrase that they can use is, I'm here, committing to valued actions. And sometimes if a client feels lost or confused or as if they have no idea where they're going, you can ask them, maybe you aren't the one driving the bus. What do you think about that? And this is where the passengers on a bus metaphor comes in to act. So this is a huge metaphor that is used a lot in acceptance and commitment-based therapy. In this analogy, everybody is considered to be driving their own bus or van in this very chaotic and unknown world. So on your bus, you have many, many passengers, and each of these passengers represents, again, a thought, feeling, emotion, or body sensation that may be trying to direct the direction of your bus. If you were to listen to these passengers, they'll probably say things like, don't go that way, that's scary, we don't want that, don't go down that road. It might lead to a pretty view, but it's a little bit bumpy and we're not good with feeling bumpy. On the other hand, if you're able to remind yourself that you are in control of the bus and that you can choose value directions that have meaning towards yourself, then those passengers can yell and scream all they want, but ultimately you are in control of the direction you go. This metaphor is also really, really helpful working as a clinician because there may be times where you have a client where you feel like you're telling them to do these things and recommending these things and they're just not doing it. Well, ultimately, we are passengers on our clients' buses as well. And we can say all the things we want, we can point them all the directions we want, and ultimately they're in control of the direction they decide to go. So this can also be really freeing from a clinical standpoint because it puts that control back in the client's hands and puts them back in the driver's seat. So it's a good opportunity to kind of check yourself and also work again on reducing that burnout. Our fourth core yearning is feeling. So we yearn to feel and come in contact entirely with our experience. An inflexible response to this means, yeah, sure, I agree, but only these 3 emotions or only these 2 emotions. So it really reduces what we're willing to feel and can lead to clients feeling numb or suppressing their emotions. And there's also just, again, not a lot of growth because we're stuck in only one perspective, and this is avoidance. If we're able to help our clients move towards acceptance, they can have a more flexible response where they can work on accepting all of their emotions as part of their experience. And according to ACT, emotions and thoughts and even values are neither bad nor good, they just are. So if we're able to take the judgment and evaluation out of those various items, then that can really help our clients work towards acceptance. It's also important to remind clients, and this is a hard one, that pain is inevitable, but suffering is not. So I've worked with clients before who want recovery, but only if recovery looks like X, Y, Z. Or I only want to feel this way, and if I'm feeling anything else, something must be wrong. So it's been quite a journey to really work on helping broaden their perspective by slowly reminding them about acceptance and pivoting them towards a flexible response. And you can see some of this that happens in our culture because we live in a culture of feel-goodism, where feeling good is really seen as amazing and what we all want in our life, and feeling bad is seen as bad and something is wrong with you if you're not happy all the time. So there's a dark side to feel-goodism. And this dark side comes with a couple core issues. So for example, I don't want to feel bad, I only want to feel good. Okay. So therefore, if I feel bad, I must be doing badly. And therefore, something must be wrong with me, and that leads to shame and isolation. And at the same time, if we look at that phrase, something is wrong with me, you could even replace it and say emotions are wrong. And that leads to shame and isolation. And that doesn't lead to a lot of growth. And when we look at shame and isolation, these are individuals who are completely feeling alone in the world because they are experiencing something different than what is seen in our culture as good or acceptable. In ACT, every single emotion has a place, and it doesn't need to limit or change our direction. And this includes those emotions that may be considered challenging, like anxiety, fear, shame, etc. When we do try to suppress our emotions and stay in that feel-goodism, happy all the time, let's just spread positive vibes, we can really see the dark side come out in the Wheel of Suffering. This is a handout that has been attached or will be attached to the webinar on the website, so you can print this out and use it with your clients. I really like the Wheel of Suffering because it's a great visual to show the difference between acceptance and being present versus avoidance and what that looks like on a tangible basis. When we look at the thing that caused us pain, that will be the center of our Wheel of Suffering. And we have the option to address that thing that caused us pain, but again, that causes us to have to address pain, which a lot of us don't like to do. So instead, we may have feelings, thoughts, or reactions to that painful experience. So for example, if you're bullied for your appearance, you may feel shame. You may have the thought that you're a failure, no one likes you, you'll never amount to anything. And a lot of times these initial thoughts may be somewhat inevitable, but that doesn't mean we can't pivot back. So we have these different feelings, thoughts, or reactions, and we don't like them. They're uncomfortable, they're not good vibes only, they're hard. So we'll do things to try to avoid those feelings that come up. For example, an individual struggling with an eating disorder may purge or restrict foods, they may isolate, they may compromise their values or notice that they're following values more in line with their eating disorder than their self as context. There are some consequences that come with avoiding those feelings. So for example, your health may decline, you may feel more depressed, you may feel more anxious, everything is kind of piling up a little bit more. And then you may have new feelings or thoughts or reactions to these consequences. So for example, I'll never be good enough, I'll never succeed, I'm a failure, it just keeps getting worse and worse and worse. And we can help our clients interrupt this process. So again, pain is inevitable. Unfortunately, if we're human, we are going to experience both physical and emotional pain at some point in our lives. However, we do not have to suffer as a result. So you can experience pain and have a reaction to it. And if you're able to pause and remind yourself to be present or remind your clients to be present by addressing that pain, then you're less likely to find yourself in the Wheel of Suffering, getting larger and larger and larger until you can barely even remember what that original thing was that caused us pain. The cool thing about the Wheel of Suffering is that you can always come back to the middle. Sometimes we may need a little bit of help or assistance along the way, but you're always able to come back. And the quicker you can come back, the less likely you are to suffer or to have additional consequences as a result. Our next core yearning is self-directed meaning. So we want to be in control of our lives and we want to make our own choices. An inflexible response to this core yearning may be over or under control. So again, I mentioned before, I work with clients who struggle with eating disorders primarily. So over control may present itself as a client who is really restricting or practicing perfectionistic tendencies. Under control, on the other hand, may be clients who are purging, perhaps using substance abuse, really acting outwardly rather than inwardly. And these clients may have difficulty making choices. They may be really focused on very rigid thinking and self-gratification and aversive control. So what this means is, again, that we are focusing on feeling good and not feeling bad. However, if we're able to live in accordance to what we value rather than avoiding what we fear, we're a lot more likely to have a life that is filled with greater meaning and purpose. This isn't to say that that life will be easier. It may be just as challenging, but it is more focused on qualities of given actions and can help our clients feel as though they do have control and that their path they are going on does have a purpose. Let's talk about valued actions and what that means according to acceptance and commitment therapy. According to ACT, values cannot be right or wrong. I think if I want you to take anything out of this presentation, it's to get rid of the judgment and evaluation associated with values, thoughts, or emotions. So it cannot be right or wrong. They are not goals. They're never finally completely accomplished. An example that I like to use is skiing. So if you have an individual who likes to ski, when you talk about skiing, they're probably saying that they enjoy the actual process of going down the hill more than just being done skiing. And values are kind of the same thing. We're looking at the process, not necessarily the outcome. So values will help us choose an action, but they won't determine exactly what the end game is. One way that you can help your clients take action is simply asking them to monitor their current behavior and to create some goals that are aligned with their values. You can also have them ask, does this align with my values, or am I being fused with my thoughts, feelings, or emotions? Or are these values according to my eating disorder and not necessarily the values that I have? And if a client struggles to separate themselves from their eating disorder versus what they think, it can be helpful to ask them, what were you like before you started struggling with your eating disorder? How have your friends or family members shared that you've changed, or how have your relationships been impacted by this? And that can kind of help pivot them or remind them that there was something else there before they started to struggle. Our final core yearning will be competence. So we yearn to be good at what we're doing. An inflexible response to this is, well, I want to be perfect. And if I can't be perfect, then I don't want to try. This can lead to people feeling incredibly stuck, unable to move, and really only focused on the outcome. So I had a client that I had worked with as an adolescent who had wanted to go to college but was too afraid because she thought that if she went to college, she would completely fail and flounder and there was no trying at all. So she was very, very stuck. And I had to explain to her that if all you do is focus on being perfect and never growing or changing or even failing, you're never going to move forward. And so in doing that, I was able to help pivot her over to committed action, which is reaching outside of your comfort zone and trying new things in accordance to your values. Life is hard and trying new things is hard. But if we're focused more on process versus outcome, okay, how is that experience for you? It's a lot more approachable for not only us, but also for our clients. So when I was able to talk to this client about trying something new, and if things don't go well, we can talk about it and process it. She was able to actually apply to school and start college, and she ended up doing great. And so she was able to really look back and notice that that fear that she had was actually an irrational fear that left her paralyzed, versus when she was able to be flexible and recognize that she's growing, she was able to continue to move forward with her goals. I've also seen this in clients who struggle with recovery, and they say that the only type of recovery that I would like is the recovery where I am this size and I have only these good emotions and life is really, really good. That's a great image that you can have, I suppose, but that doesn't necessarily mean that's a flexible response or something that's going to last. So if you're able to help your clients recognize that failure will happen, you will mess up, and that doesn't mean that you have to be stuck there, then that can also help clients commit to taking action. So I want to go over just briefly the difference between process versus outcome-based therapy according to Stephen Hayes. So outcome-based therapy is focused more on the goals of our actions. And this is probably most therapies, I would say, are outcome-based. This can draw attention away from the present moment. Not always a bad thing, but it can happen. And for some clients, it might feel as though they're continually falling short. So if you have a client that is very black and white in their thinking, and then they're coming into a therapy that's also very black and white, that can be incredibly challenging to help them grow in flexibility, and actually can sometimes lead to them feeling even more rigid. Process-based therapy, on the other hand, is focused on living and being present. So there's not necessarily something final to be achieved, although there are goals that we do create. We're focused more on direction rather than destination. So the concepts and acts can be really, really hard for some clients to understand or be willing to try because they're quite different. As I mentioned before, it's kind kind of the opposite of black and white thinking. We're really navigating more of a gray area, which does make it more approachable and sometimes more authentic feeling, but at the same time more challenging because it's something different. So it's important to introduce willingness. And I love this introduction to willingness as a compassionate act of self-validation in which you embrace the here and the now as it unfolds. Willingness is a choice. So one way that you can help your clients understand willingness is have them, if they're medically cleared, of course, stand on a piece of paper and ask them if they would be willing to jump off that piece of paper onto the floor. You know, it's very, very small difference in height. If they are willing, you can ask them to process, you know, what made you decide to be willing to do that? Because it may have felt silly to you, you may have been uncomfortable. What made you willing to do it? And did you have any reasons you didn't want to be willing to do it? And if they do, you can teach them that you can observe your reason for not wanting to be willing, and you can still take action. So, for example, you may have a client who does not want to be willing to talk to their parents about struggling with increased depression or increased anxiety or things like that, and they can still take action. So it's not necessarily the reason that chooses, it's the person that chooses. And I really love this about ACT because it says that we don't have to wait for those difficult thoughts, feelings, emotions, or body sensations to go away in order to take action. You can take action while they're still there. And not only that, ACT says that these difficult feelings are something that's going to be a part of your life forever and show up in different ways, and you can learn how to cope with it and continue to grow anyway, not waiting for them to go away. Another way that you can help your clients to be more willing to try something different is just to ask them to list all the things that they've tried to do to overcome their eating disorder. And ask them honestly, have these worked? Most of the time, if they're in your office, the answer is probably no. If the answer is no, you can ask them, would they be willing to try something different if it meant they got to live their life a lot differently? I've seen some clinicians add a time frame to this question and say things like, if not, would you be willing to try this for a year and see how it goes? Or would you be willing to try this for a month and see how it goes if it meant you got to live your life? So that is another way that you can ask that question and hopefully help introduce and teach some willingness to your clients to try something different. Another way to increase willingness and the commitment to change is to teach them to commit not to perfection, but larger and larger value-based actions. They have enough perfectionistic tendencies going on in their world that don't need to come into the therapeutic office. Mistakes will happen. Pain is inevitable for all of us. So when you or your clients make a mistake, you can ask them or yourself, which of your values have changed? If your values or their values have not changed, they have two choices. They can commit, slip, quit, and be completely done because they didn't reach this goal that they thought they could achieve very early on. Or you can commit, slip, and then recommit. And this is really where authenticity comes into play with ACT because it doesn't sugarcoat things. You know, recovery is hard, life is hard, and you are going to struggle. And that doesn't mean that that needs to stop you in your tracks. So I love this question. I love how authentic it is and how applicable it is not only for myself, but also for my clients. So I've given you a lot of information about ACT. And if you're finding yourself a little confused or you want to learn even more about ACT specifically and the roles that it can play in body image and treating eating disorders, I highly recommend my previous webinar from last year available on Center for Change's website. But for the purpose of this webinar, I have 4 simple examples of putting ACT into practice that I thought would be helpful for all of you to know. The first one is an art piece. As Tamara mentioned, I love bringing art into my office, especially with adolescents. It's a great way to get them engaged, to get them talking, to have something to do. So the passengers on a bus exercise is a really, really great exercise to do in session. And then once you have those passengers identified, you can have that opportunity to ask your client, which of your passengers are you allowing to drive the bus, or are you the one driving your bus right now? There's also an experiential example. So you can have your clients write down, for example, a thought and show with their body how close they feel they are to that thought. So for example, I have this thought, maybe it's on a sticky note, and that thought is so attached to me, it is me, I'm very fused. Versus, okay, what would it take to get that thought to be just a little bit further, and would you be willing to learn about the skill of diffusion with that thought as an example? If you like worksheets, which also love a good worksheet, the Wheel of Suffering is a great one to use. And I've actually used the Wheel of Suffering in family sessions where the thing that caused the pain was the eating disorder. And I have the adolescent and each of the parents, if they have two parents, work on identifying how they felt when they noticed that their adolescent was struggling and what they did to cope with it, and what everybody has done rather than address the elephant in the room or the eating disorder. Journal exercises can also be very helpful, and I believe there are some optional journal prompts that I've attached to this presentation as well. So you can have your clients write down, for example, what painful thoughts came up each day and what they did to escape or avoid them, and then what it cost them to practice that avoidance rather than address it in the moment. My final thoughts are that you're uplifted in your life by people that model psychological flexibility in their relationship with you. So the people that are in your corner, the people that lift you up the most, are probably not the ones that are extremely rigid in their thinking and how they approach you. So why would that not also be true for your clients? Again, they have enough perfection going on in their internal lives and maybe external lives outside of the office, so why would we bring that also into our office? Modeling happens in the in-between. And I love that ACT can help both clients and clinicians pivot our responses to these core yearnings from inflexible responses to flexible responses, because it makes us all human and we are all connected. So really, really important that we do our own work, especially if you are working with clients and wanting to see big changes in the way that you implement ACT in your practice. I do have some assessments and additional trainings available for you guys to look at. I can't remember if I attached this or not. If not, it is available online. So there is an acceptance and action questionnaire that you can use weekly or bi-weekly to measure psychological flexibility with your clients, also with yourself. So it's kind of a cool questionnaire to track your progress or your client's progress. The ACT Advisor is great. It can be used to help identify how you're doing and learning different flexibility skills. And I also have a couple different trainings listed. The training that I really enjoyed was the ACT Immersion training on stephenhayes.com, and you can learn all about pivoting and core yearnings and core processes through that training, but there also are two other ones listed on there. As far as reading goes, I recommend this almost in every single webinar I do. I recommend the workbook, Life After Trauma, Using Acceptance and Commitment Therapy to Heal from Trauma and Post-Traumatic Stress Disorder or Post-Traumatic Stress by Follett and Pistorello. So this workbook is really great, not only for clinicians, but also for clients, because it provides so much psychoeducation about ACT, trauma. It has different worksheets. It also has little bells inside of it that it's like a symbol of a bell, and a client will be reading it, and then there will be a little bell with a reminder for them to be present in the moment. So it's something that I like to give my clients who are unable to come to sessions weekly or who are really struggling and need something to do outside of session, but you can also do it in session. So really, really great. Acceptance and Commitment Therapy for Eating Disorders is another good book. Learning ACT is a classic, definitely a great place to start. The Happiness Trap is very informative and was really challenging in some ways for me to read, but also very, very educational. And finally, The Upside of Stress by Kelly McGonigal isn't necessarily specifically geared towards ACT, but it's all about using your stress in ways to help you rather than hurt you. So there's a lot of parallels there with your emotions, using them to help you and working through them rather than trying to suppress or avoid them. Then I also have a ton of references if you're wanting to look up any studies about ACT. And with that being said, that's the end of my presentation. So I have about 10 minutes for questions or comments.
Thank you, Allie. We have lots of questions.
Oh.
Before we jump into questions, which is great, but before we jump into questions, I just want to go over a couple of quick housekeeping things in case folks need to jump off to go do a session. So just a reminder that when the webinar does end, that there'll be an evaluation that will pop up on your screen at the end. If you would please take 30 seconds or so to answer those questions, that would be really helpful for us. Again, that's a continuing education requirement for Center for Change. It's completely anonymous, so feel free to be candid in your feedback. And then we give those results to the CE entities. And then lastly, about an hour after the webinar ends, you'll receive a separate email from GoToWebinar with the link to take the online test for CE credit. You must take the test online, and once you pass it, that continuing education certificate will automatically be downloaded to your computer. So if you don't see it on your screen, look in your downloads file because sometimes it hides there. All right, Allie, here we go. Here's the first question. This is from Kendra. Kendra says, I have clients who say their primary value is beauty and their version of beauty involves being a certain weight. How do you typically address that in the context that values cannot be right or wrong?
Ooh, I knew someone was going to ask this question.
Good one.
So one of the questions that I like to do in body image actually is to have them think about the people that they most admire in their lives. And it may be the case that all of them are a certain weight, but likely there's probably at least one that does not fit into that beauty standard. So that can be a good way to open the door to conversations. Additionally, you can, I just lost my train of thought. Additionally, you can ask them what beauty means to them and what that number means to them. And in doing that, maybe they're saying, okay, I want to be this amount of weight. And if I'm this amount of weight, then I'll belong. So that can actually be a good conversation piece to help them recognize that, okay, maybe it's not necessarily about the weight. Maybe it's about your core yearning to belong. And so let's take that number out of the equation and focus on helping you address that core yearning instead. And I did say, you know, values can be right or wrong. You're absolutely right, or cannot be right or wrong. You're absolutely right in that. And so it's not our place to necessarily say that what they're feeling is wrong. It's important to acknowledge it and at the same time help them acknowledge that core yearning, possibly by pivoting to something a little bit different.
Got it. Thank you. This next question is similar. This is from Carrie B. And Carrie says, value question regarding adolescence. When parents and teens' values are different, how do you manage that?
Well, that is the question of every therapist that works with adolescents, I think. So what I do is I try to see both of their perspectives. You know, if I have an example, maybe an adolescent has a value of wanting to spend time with friends instead of time with family. So I try to help them both understand the perspective of where each of them are coming from. And again, digging a little bit deeper, what is the core yearning behind that value? So maybe they want to spend more time with friends because they want to be heard. Maybe their family wants them to spend more time with them so that they can help their clients. So really digging a little bit deeper into what that core yearning might be.
Great, thank you. This next question is from Regina M. Regina says, could you give an example of, fabulous. Could you give an example of a goal of process-based therapy versus outcome-based therapy?
Yes, so a process-based therapy goal would be a valued action. So for example, you can have clients think about, I have a worksheet that I do in my ACT group where you look at different domains of values. So for example, one of the domains is family. Okay, if you value family, what are some things that you're doing right now that align with that value of family? So for example, maybe that would be financially supporting them or spending time with them. What are you doing right now? And then once you're able to find that baseline of what you're doing now, it can help you measure whether or not you're continuing to live on that baseline or if it's going up or if it's going down. So it's still a goal. It's just a little bit of a different way to think about it because you're more focused on the valued actions occurring in the process.
Thank you. Just FYI, we had several people, a number of people asking about ACT certifications and trainings, and that was prior to your third to the last slide, I think, is where those are. So just a reminder to everybody to take a look at that slide, and that'll give you some great resources for additional trainings. Okay, this next question is from Julie F. Julie says, do you have specific techniques that you suggest when you know your client isn't being honest with you? Obviously don't want to shame them, but also feel the lies are keeping the client stuck.
Yeah, so my biggest suggestion, I cannot talk right now, for that is to use humor. So I really focus my first couple sessions with my adolescents, especially on building rapport and having a good relationship with them, so I can challenge them gently with humor. So for example, okay, you're saying this, but then you're also saying this, like, help me understand what's going on here. And if you have that relationship, sometimes they may not even fully understand that they are being a little bit dishonest, so you can gently point it out. But if you don't have that relationship, it can be really hard, because if you're challenging them, they may completely shut off. So if you're having that issue, I would say first focus on the relationship and then bring in addressing the dishonesty through humor if you can, or through that as a foundation.
Great, thank you. We have time for one more question. And then if we weren't able to get to your question today, Allie's contact information is on her last slide, so you're welcome to reach out to her directly. Okay, so, oops, now it's off my screen, but hang tight, I'll get back there. There we go. Can you review how you guide clients to interrupt the processes in the Wheel of Suffering?
Yes, so I like to do the Wheel of Suffering with my clients obviously first before telling them they're in their Wheel of Suffering, so that they know what I'm talking about. I also do it in a group, so that helps kind of all clients here at Center for Change Boise know what I'm talking about when I represent it. So if I notice that they appear stuck or in similar cycles that they've been in before, I might just take out a blank sheet and say, where do you think you are at in this wheel? And then if they're able to recognize that they're at it in a certain area, then we can go back and think about what is the thing that caused you pain, and what yearning are you trying to meet through avoiding or suppressing what you're going through right now. So what's something different that we can try, and would you be willing to try something different?
Great, thank you. Thanks everybody for joining us today. Again, watch for an evaluation that'll pop up on your screen here in just 1 minute when I close the webinar. And then about an hour from now, a separate email with the link to take the online test for continuing education credit. Our thanks again to Allie Willits, who did an amazing job, and we're so happy all of you could join us. Please stay well, and we hope you can join us for our next webinar next month. Take care, everybody.
Thank you.